Hello and welcome to Pharmacomania. I'm Dr. Shahnaz Malik and we are going to discuss local anesthetic substance. So here is the material taken from the standard book of the pharmacology. Now individual local anesthetic substance. First is the cocaine. It is prototype drug and only naturally occurring local anesthetic agent, ester linked compound and medium potency as well as medium duration of action. Primary therapeutic use is ophthalmic anesthesia. As a part of topical anesthesia, tetracaine, adrenaline and cocaine can be used. Marked vasoconstriction action due to inhibition of catecholamine uptake and cardiotoxicity and euphoria limit the value of cocaine. Second drug is procaine. It is the first synthetic local anesthetic substance, shorter acting. It is ester-linked local anesthetic substance. Form poorly soluble salt with benzyl penicillin. If combined with the penicillin, it forms procaine penicillin, which is useful intramuscularly for the slow absorption of penicillin. Procaine is not used nowadays due to less hydrophobic and low potency, rapid degraded by pseudocholinesterase. So it is not useful. Chlorprocaine, it is the chlorinated derivative of procaine. Advantages of the chlorprocaine is it is rapid onset of action and shorter duration of action. Half-life is 25 seconds. And disadvantages are mainly due to its preservative. Earlier, sodium metabisulfite were used, so large dose intrathecal injection causes prolonged sensory and motor block. Nowadays, calcium ADTA is used. So tetany of paraspinous muscle and back pain are disadvantage of chlorprocaine. Tetracaine, it is highly lipid soluble PABA ester, and advantage is it is more potent, longer duration of action than the procaine, and disadvantages it is slowly metabolized by plasma pseudocholinesterase and more systemic toxicity can occur. Current status of tetracaine is it is widely used as a spinal anesthesia when long duration of action is required. Topical application like in eye, nose and throat, and peripheral nerve block are rarely it is used in peripheral nerve block due to slow onset and larger dose is required. Benzocaine and butyl amino benzoate, very low aqueous solubility, not significantly absorbed from the abraded skin or mucous membrane, long lasting anesthesia without systemic toxicity, and it is useful in stomatitis, sore throat, wounded ulcerated surface or anorectal lesion. Lignocaine, it is most widely used local anesthetic substance. Advantages are it block conduction within 3 minutes when procaine inhibit within 15 minutes. Intense and longer lasting anesthesia, no cross sensitivity with ester local anesthetics, and disadvantages are CNS depression action, overdose can cause muscle twitching and cardiac arrhythmia, and also decreased blood pressure, coma and respiratory arrest can occur due to lignocaine. Uses of lignocaine are it uses surface application or surface anesthesia, infiltration, nerve block, epidural and spinal block, intravenous regional block, and as an antiarrhythmic drug. Prilocaine, it is intermediately acting local anesthetic substance. Differences from lignocaine are not cause vasodilatation, large volume of distribution, so less CNS adverse effect, and disadvantages is orthotoluidine metabolites causes methemoglobinemia. Risk of neonatal methemoglobinemia can occur, so it is not used in obstetric practice. Eutectic mixture of local anesthetic agent or EMLA. It is eutectic mixture lowering the melting point of two solids when they are mixed. Eutectic lignocaine and prilocaine both are mixed in equal proportion at the 25° centigrade temperature. Resulting oil is emulsified in water to form cream. This can apply under occlusive dressing 1 hour before IV cannulation and skin grafting. Eutectic mixture is unique preparation of anesthetized and take skin after surface application. Anesthesia up to depth of 5 mm and lasts for 1 to 2 hours after removal of eutectic mixture. Now bupivacaine, it is 4 times more potent than lignocaine and longer acting and highly lipid soluble drug. It is drug of choice for obstetric anesthesia. It is adequately analgesia without significant motor blockade and less likely to reach fetus to produce neonatal depression. Disadvantage is it causes prolongation of QTC interval, cardiac depression, tachycardia, and not to be used intravenously. Divocaine, it is most potent, most toxic and longest acting local anesthetic substance, and it is useful for surface anesthesia for less delicate mucous membrane like anal canal and rectum, and it is rarely used for the spinal anesthesia. Ropivacaine, it is neurocongener of bupivacaine and less cardiotoxic and more motor sparing local anesthetic substance. Articaine, it is newly introduced amide linked local anesthetic agent and rapid onset of action within 6 minutes and duration is for 1 hour, suitable for shorter procedure like dental and periodontal procedure. Binoxidate is good surface anesthetic substance for eye, little irritancy, rapid corneal anesthesia without mydriasis or corneal damage. Oxythazane, it is potent topical anesthetic substance. Ionization is very less even at low pH. Anesthesia of gastric mucosa, symptomatic relief of gastritis, drug-induced gastritis or irritation, GERD, heartburn of the pregnancy. In this whole condition, it is used as a local anesthetic or topical anesthetic substance. Mepivacaine, it is intermediately acting action similar to lignocaine except slight longer duration of action, and it is not useful in neonate or obstetric anesthesia. Lower pH of neonatal blood causes iron trapping and slow metabolization, so it is not useful in the neonates. Premoxine is useful as a surface anesthesia on skin and mucous membrane and not used in eye or nose due to irritating effect. Preparation are available as a cream, lotion, spray, gel and wipes or soaps. Diclonine hydrochloride is rapid onset of action and it is useful for topical anesthesia during endoscopy, for oral mucositis, pain following radiation or chemotherapy, and anogenital procedure. Active ingredient for OTC drug like lozenges. Clinical uses and technique of local anesthesia. Topical anesthesia, infiltration anesthesia, field block, nerve block, intravenous regional anesthesia, spinal anesthesia and epidural anesthesia. All these anesthesia are various technique of local anesthetic, local anesthesia. Thank you for watching the video.